Hello, my name is Marian Hudson, and this is my capstone educated citizen presentation for the BSN program. I will begin by introducing my public health issue, the mental health of African American youth. The terms African American and Black will be used interchangeably. In 2020, Dr. Rachel Kliss-Holbert reported that there had been an over 70% increase in suicide rates since the 1980s among African American teens, and that African American children were significantly less likely to get help with their mental health concerns. It was also in 2020 that the Douglas County Board of Health declared racism a public health crisis. Dealing with discrimination and racism can lead to trauma. In addition to this, North Omaha History reported that in 2022, 6 out of every 7 Black children in Omaha lived in poverty. Both trauma and living in poverty are risk factors for developing mental health issues and illnesses. As a Black woman, I dealt with mental health issues in my youth that directly related to my race, discrimination, and socioeconomic class. I am also a mother to 6 children who are each dealing with their own issues. As an adult, I can see how childhood trauma and lack of support in addressing mental health concerns can have such a profound effect on one's psyche and how life altering it can be. Through my connections to and research done on this topic, I have been able to apply the aspects of being an educated citizen to really understand how I can make a significant difference for this community. To address the aspects of being an educated citizen, I will begin by discussing what it means to be an effective communicator. An effective communicator uses critical thinking to generate, connect, and organize ideas in a written, oral, and nonverbal manner. The first experience that I will share happened early on in nursing school. We had a scheduled practicum the week after spring break, and it was an expectation to come prepared. We were also expected to practice in the Nursing Arts Center during open lab. Unfortunately, the facilitators had only one day available to hold open lab prior to our practicum date. This didn't work for the majority of us, and knowing the expectations and the dilemma that we faced, I spoke up and mentioned this to our instructor. I was provided with the facilitator's contact information and told to keep the instructor abreast of the situation. I asked my classmates whether they would like me to try to set up additional times. There was a collective yes, and so I moved forward. After back and forth calls and emails, I was able to procure 3 additional lab times. I discovered from this experience how much effort multidisciplinary teams require and how satisfying the results may be. With the patient's trust, you work as a team to provide the finest care possible. Having effective communication skills is crucial. Through collaborative efforts, I am confident that we can turn the tides on the mental health war Black youth are fighting. Through the use of clear, concise verbiage, verbal and nonverbal, I would be able to convey the needs of this population to potential partners and help develop a policy, initiate the appropriate changes, and build community relations. The second experience I'm sharing involved a type 1 diabetic patient who was reported to be non compliant with care's argumentative and mistreated staff. The patient connected with me because we were the same race. And I can definitively say this because of a conversation that he and I had, where he stated that one of his people was finally here to take care of him. With me, he was compliant and more receptive to care. Acting as a mediator of sorts, I learned what the problem was from both the patient and staff, and miscommunication was a large factor. Code switching is a term you may not be familiar with, but it is the ability to change the language you use to fit the situation at present. While remaining professional, I was able to use a dialect and terminology that the patient was comfortable with to help all parties involved. It is our job as nurses to ensure that we are adequately conveying information and minimizing the chance for miscommunication to happen. This is where the educated citizen's ability to effectively communicate becomes an important factor. You must maintain your professionalism, be open minded, and accept criticism in order to communicate effectively. You must listen just as much as you speak, consider the needs of others, and recognize that not all communication is simple. In addition to different forms of communication, we must acknowledge barriers to communication, such as culture. Much like being able to code switch, thinking creatively and unconventionally is sometimes necessary for effective communication. By using a means of communication that is most appropriate for the population I am addressing, I would be more likely to build a connection with them and address their needs, allowing for information to be shared, concerns to be addressed, and solutions to be found. Next, I will address being a reflective individual. A reflective individual routinely engages in habits of inquiry and influence, ways of thinking, and actions. During the semester, I changed jobs within the company that I work for while caring for my family and taking 15 credit hours at school. And I just felt like the world was crushing me at the time. I found myself asking what I could have done differently or how I could ease my stress. It took a lot of crying, venting, and threats of quitting, which of course I would never actually do, to get through those few months. After the dust settled, I thought back to how resilient I was and how there are people going through so much more than me. I realized how lucky I was to be advancing in life, to have a healthy, happy family, and that had it not been for my support system, I would not have made it through that very busy, stressful period. Part of being a reflective individual is knowing that you will make mistakes and having the ability to examine past experiences so that you can make better decisions later in life. It is asking yourself, how can I use this to help myself and others going forward? It's not waiting until things are over. It's trying to be proactive about future consequences, whether good or bad. Going through this gave me the tools I needed to support others when they too are going through stressful situations. I use my experiences so that those I am working with and clients I am helping know they are not alone. To build rapport, provide guidance based on familiarity with certain events, and stress the importance of addressing issues before things escalate. My next patient was an 85-year-old female admitted with multiple comorbidities, including CHF, CKD, and colon cancer. The patient's code status was documented as a DNR, but she wanted to be intubated, but no compressions performed, and wanted full aggressive care. Oncology informed the patient that they wouldn't be able to treat her with chemo or radiation and suggested that she consider hospice care. Eventually, palliative was brought onto her case and tried to explain her prognosis and why certain diagnostic tests and treatment were no longer viable options. However, the patient's providers were still giving her different treatment options. I found the inconsistencies between what the patient wanted done and what her multidisciplinary team were doing to be mind boggling because they didn't match up. I couldn't understand how all these providers were coming up with treatment plans that weren't complementary of one another. And if they were explaining things, then she should understand. I was able to sit in on a palliative consult with this patient, and the palliative team was using medical jargon, and it was just clear that the patient had poor understanding. As a result, she became anxious and overwhelmed. Afterward, instead of brainstorming how they could help with her comprehension, the palliative team made jokes about the patient and her family's inability to understand. This situation taught me that there is always more going on than what we initially see. This awareness has allowed me to see that to adequately care for my patients, I need to take the time to listen to their concerns and act on them. Once I realized she was being given contradictory options for and information, providers showing lack of empathy, and that she had all these bottled up feelings, I changed my tune. Being a reflective individual involves looking back and analyzing not only your actions, but the actions of those around you and reflecting on past events with the intent to learn from them. There is power in talking with and getting to know your patients. It gives you a real feel for what their needs are as individuals. And knowing that emotions can cause barriers to care and that religion and culture can play roles in care as well. It takes one person to approach the situation from a different angle to help a patient gain better understanding and or calm them. In doing this with the affected population, I gain a better chance of them being receptive to education and treatment for their children's mental health. The last aspect of being an educated citizen is being a change agent. A change agent uses the disciplines of the liberal arts and sciences to analyze historical and contemporary situations and systems to develop cultural competence and to take the appropriate initiative to effect change. I cared for an 89-year-old female who was admitted because of a hip fracture. The patient had stage 4 uterine cancer with bone metastasis, dementia, and several other comorbidities, and was not a surgical candidate. During her stay, she had a significant decline in her health. After discussing the patient's prognosis with the doctor, the family still wanted her to remain a full code. The patient, however, would repeatedly state that we should just let her die and she doesn't want to live like this anymore. The patient's POA was made aware of this, and they admitted that the patient once told them that they would never want to live like this, but the family just isn't ready to let her go. Her primary nurse and I discussed the best way to educate this family. The first step was to gain an understanding of what their health literacy was and what they understood the patient's prognosis and treatment options to be. Then we asked the family what about their understanding of what full aggressive care meant and what it looked like. They didn't know. This involved a lot of family education. In the end, the family decided it would be better for the patient to go on comfort care. They decided it would be better to let the patient die comfortably and on the terms she wanted. It is not my job to influence decisions, but it is my job to make sure that patients and families are well educated when it comes to disease processes, treatment plans, and other care options that fall within my scope to explain. As a change agent, it is my duty to advocate for my patients and for what they want. I was afforded the opportunity to incite change for an individual person. Being a change agent is not always about the changes we can make on a grand scale, but whether the small changes we can influence that can make a world of difference too. Change agents aim to create a better quality of life for all involved from birth till death. As change agents, it is our duty to understand other perspectives, analyze how those perspectives affect others, and take the necessary measures to change the narrative and advocate for those who need it. For this population, it is imperative that we advocate for them. There are misconceptions of what mental health care and mental health care providers look like in the Black community. And I would be remiss if I did not discuss just how important it is to educate and get parents, families, and care providers to overcome these barriers to take an interest in care for these children. The last example I'm sharing is a story an 87-year-old retired public health nurse shared with me about a boy and his siblings that ended up in foster care. The kids were kept together, and the family they'd been with for a few years decided it was time to adopt them all. At the same time that this decision was being made, the boy's father was released from jail and decided to challenge for custody. My patient described the challenges that the family faced and what she did to ensure this child was able to stay with his siblings and his chosen family. My patient discussed the way she advocated for this child and the backlash she faced for becoming so involved with the family. She was often told certain things weren't in her job description to do. My patient told me that she got into nursing to care and advocate for people, and she once said, "If I don't advocate for them, then who will hear their voice? Who will do what is in their best interest?" My patient and the social worker assigned to the boy's case worked together to prove that the boy was without a doubt in the best situation he could be in, and that placing him into the care of his father would do more harm than good. Thankfully, the boy was able to stay where he was and was later adopted by the family along with his siblings. One attribute of a change agent is being able to take initiative to affect change by bringing people together to reach a common goal and to create a voice for themselves and others. My patient taught me just how much of an impact I could have on someone's life. Agents of change, first and foremost, are advocates. Sometimes, to truly make a difference, we must go against the grain and fight for what we believe in. Through advocacy, we make impactful decisions and statements. As reported by Dr. Uchenna Ume in 2019, it was once believed that Black people did not suffer from mental health issues. Then it was believed that what we considered mental health issues for Black people was really just fatigue or exhaustion. Even now, decades later, after those beliefs have been debunked, there is still little in the way for treating Black mental health issues. For children in general, there is a wait and see attitude around diagnosing mental health concerns. Knowing this, I am one of many that can advocate and fight for Black children to see a change in addressing and treating their mental health and normalizing mental health care in the Black community. To conclude, I'd like to say that it is imperative that we address the mental health of Black children. The sheer number of those committing suicide or the adults that admit they had undiagnosed anxiety and depression as children is something we cannot ignore. It is my duty as an educated citizen to understand that without fighting for this population, we are failing them. Black children, in addition to learning who they are, deal with transgenerational trauma, racial discrimination, cultural stigmas, and more. It is my duty to advocate for these children and the necessary changes that need to be made to help them. As a mother to 6 Black children, each different in their own way and dealing with separate issues, I could never forgive myself if I did not stand up for them. As a real well-rounded, educated citizen, I am here to initiate the change I know these children need, using current initiatives and a collective effort from community figures and businesses, utilizing established organizations, applying for government funding, engaging community members, and getting the commitment of time and treatment by mental health care providers. We can appropriately and adequately address the mental health of Black youth at the local, state, and federal levels through advocacy, care, and representation. Thank you.